Hello. So this is a continuation of the lecture on health assessment. And in part one of the lecture on health assessment, I had discussed the preliminary information about health assessment. We had looked at the definition of health assessment. We looked at the different types of health assessment. Okay, we had looked at the purposes of conducting health assessment, and then we moved on to start looking at health history, where we defined what health history is, and then we looked at the different types of health history, okay, and the purpose of collecting health history, and then we went on to we started looking at the components of a comprehensive health history. So now we'll move on and finish off looking at the components of a comprehensive health history. So we had started looking at the first component, which is the biological data, and I was talking about ethnicity, okay, the race. This is critical because there are certain conditions that may be common among certain races. For instance, sickle cell anemia may be more common among those races that live along the Great Rift Valley, and among those races coming from places where malaria is predominant, because sickle cell anemia actually came as an evolutionary adaptation to malaria, and I will explain that in detail when we discuss sickle cell anemia. So we also collect information about the religion, but not just the religion, but also the denomination in that religion, because there are certain religious practices that affect health behaviors. For instance, in certain religions, they may not take certain foods. In certain denominations, even within Christianity, there are certain denominations that do not accept certain medical procedures, so you need to be aware of that. Then marital status, you need to know your patient's marital status, because marital status has a lot of influence on health. There are certain conditions that there are certain conditions where marriage is actually a risk factor for that condition, commonly HIV. So HIV might be more prominent among being married might be a risk factor for contracting HIV, because in a marriage, normally you will expect that people will indulge in unprotected sex. Then you need to collect information about the next of kin. Next of kin is important. This is the person who may be informed or talked to as regards the patient. This is this can be a legal guardian for a patient. It can be a spouse of the patient, or it can be any person that has legal rights or legally related to that patient, or by the patient's instruction. They may instruct you to put a certain person as the next of kin whom you can contact if you want to communicate any information regarding this patient. So take down the name of the next of kin, as well as the address and the contacts, to make communication easy. Then you collect okay, so you want to also collect information about this particular patient's identification number. Okay, that's the NRC in our setting, in our Zambian setting, the national registration card number, because that is a unique identifier for every individual. Certain people may have names that are very common. The first name and the surname are the same as those of another person, but the NRC will be a unique identifier for that particular patient. Okay. Then under biological data, you want to ask about the occupation, because there's certain occupations that may pose a risk for certain conditions. For example, those that work in the mines, okay, they work underground, they may be predisposed to silicosis and other chest problems, okay? So you want to know where someone works and see whether that might be a risk factor. People that are in management positions, because of the psychological stress that they undergo at work, they may stand a higher risk of becoming hypertension later in life. So you might want to take note of the occupation that this client or patient has. Level of education. It is important that you collect information on the level of education because this will help you understand your patient's level of comprehension of health information. So if your patient is maybe only went up to 5th grade or 6th grade, that patient might be illiterate. So you may not want to give a brochure that is printed in English to such a patient. You may want to communicate information more by word of mouth. So you need to know your patient's level of education in order for you to determine at which level you're going to interact, okay, with this particular patient. Then you need to know the place of birth, okay, not just the area where the patient was born, but also whether they were born in a health facility or not, because that could have influenced the safety of the delivery itself. Then you want to know the source of referral. You want to know whether from which facility has the client been referred as they came to your facility. Now that is important because there are certain health services that are unique to certain levels of health facilities. So as you receive a patient who has come, for instance, from a health post, you will know that this patient was probably being attended to by a community health worker or community health assistant. So you, based on the source of the referral, you are able to tell a number of things. For instance, who could have probably attended to this patient before they came to you, what nature of services they could have been exposed to before they came to you. If this patient is coming, for instance, from an urban first level hospital, for instance, such as Chilenje or Matero, you know that this client has probably been seen, for instance, by a medical doctor, and you might, this is a patient that you may not want to be seen by maybe a clinical officer because you know they are coming from a facility where most likely they've been seen by a medical officer. So it's better they continue with another higher or specialized medical officer in your facility. Then usual source of healthcare, you want to find out where does this patient usually go to seek healthcare from. Do they go to a certain health facility or do they go to traditional healers, for example? Where do they usually go when they have health problem? This will help you to understand the patient's health seeking behaviors and to plan for their care as they're in hospital. Then you need to ask about the date. I mean, you need to indicate the date of the interview, obviously, so that it is clear in the records when you recorded this interview with the patient and when they told you they were feeling or they were experiencing certain signs and symptoms. It is very important to note the date. The file number, it's very important for record keeping. Then the primary language, okay, recording the patient's primary language will help you to know in which languages you can communicate with this patient. Then the province and the tribe may be important also to document because there are certain health practices that are common to certain regions of particular countries. So you might want to take note of that as well. So that is the biological data. So there are about, I think, 19 components that you need to collect on the biological data. And please, after this particular session, take time with a colleague, pick a colleague that you can be comfortable with, and just practice how you can ask these questions before I even conduct a demonstration practice how to collect biographic data. Just start asking your colleagues, so what are your names? Okay, I believe you are male by gender. You know, nowadays people are free to even change their gender. So someone may look feminine, meanwhile they change their gender. So I assume you are male. Is that correct? They'll tell you, yes, I'm male. Now that sounds funny, but in developed countries where they practice, where you find people that have undergone surgery and they're transsexuals, that becomes a very important question, because you write male, someone is a female, okay, they've undergone surgery to transform themselves. So that becomes, so practice how you can collect this information. Okay, where do you stay? What is your phone number? And then you're writing down on a piece of paper. Please, after listening to this lecture, pick a colleague and begin to practice how you can ask these components of the biological data. So the biological data is the first component of the comprehensive health history. This is the demographic data. Usually it is filled in a form. In every health facility, there will be a form where you put in most of this biological data. Okay, you fill in that form. The admission form will usually have spaces where you fill in this particular biographic data. So usually this is how it flows. You first of all document the patient's biographic data, okay? And then you come to the second component of the comprehensive history itself. The second component is the reasons for seeking health care. The reasons for seeking health care component is also known as the chief complaint or presenting problem, okay? So here now you want to find out from the patient, so what is the main reason why you have come to our facility today? What has brought you here? Okay, what problem has brought you here today? That is the patient's chief complaint, okay, or the presenting problem. And this is what we call the reason for seeking health care. It's a brief statement of the client's purpose for requesting care. It should be recorded in direct quotes, meaning chief complaint, you record it using the words that the patient tells you, basically in direct quotes. So if the patient says, I'm having a headache, your record will be headache, okay? If the patient tells you, I'm feeling cold, then at times I'm really shivering, and then at times I'm feeling hot, you will not write fever, okay? You write chills, okay? Patient is experiencing chills and body hotness, okay? Because fever is a medical term. So usually when we are recording the chief complaints, we don't record it using medical terms. There you will not record malaria, no. You record what the patient tells you. Now, funny enough, sometimes your patient may tell you, Nimvela malaria, okay, I'm feeling malaria-ish. So ask them, okay, what are you feeling that is making you think you have malaria? Then they'll tell you, okay, my body is hot, okay. Now, in certain cases, the patient may present multiple problems. List all of them and then ask the client to prioritize them. Of these, you've told me you're having headache, you've told me you're experiencing body hotness, you're vomiting, and you're also experiencing abdominal pains. Out of all these, which one is the biggest problem? They'll tell you, okay, I think it is the headache. The headache is really severe. So the headache becomes your chief complaint. You will notice later that when you document your chief complaint, you may find that all the other complaints which the patient had given you are actually associated symptoms, meaning the problem could be one, which is one main problem, which is causing all those other manifestations. So lists, sometimes the patient may fail to tell you which one is the biggest problem. They will tell you, well, headache and the body hotness, these are just of the same proportion. Both of these are really giving me problems. So document both of them. Okay, you write headache, and then the second one will be body hotness. I hope we are clear on that one. So under chief complaint, you record the reason why the patient has come to seek health care, and you record it in direct quotes. We should not find you have written malaria under chief complaint. Under chief complaint, you don't write general body malaise. No, you write general body weakness, because that is what a patient will tell you. I'm feeling weak. My whole body is just weak. Okay, general body weakness. You record in direct quotes. After you record the chief complaints, then you go to the next component, which is the history of present illness, or we also call it the present health status, the history of present illness. So now you want to focus on this illness which the patient has at this particular time. Okay, you want to collect information on that. And how you do this is by conducting a symptom analysis. Now, the symptom analysis is a systematic way to collect data about the history and status of symptoms. So here is a patient who has told you they are experiencing headache, okay? So you want to analyze that symptom which they've told you, the headache. You want to find out a number of things about that headache, which will give you clues as to what could be causing that headache. Now, there's an acronym that we use. It is known as ODCART. Okay, ODCART. This is an acronym that we use so that we can remember the key components of the present health status. When you are analyzing a symptom in your mind, you can use this acronym ODCART. What does it stand for? Onset of symptoms. So you want to find out, when did these symptoms start? And also not just when, but how, okay? What were the circumstances that surrounded the onset of this particular problem? Most of the time, as students, when you think of onset, you just want to ask, when did it start? If it's a headache, you just want to ask, when did the headache start? That is not enough. You want to find out, how did it start? Was it a sudden onset? Was it gradual? What were you doing when the headache started? Okay. There's someone who will tell you, okay, at the office, my boss had just told me that my contract will not be renewed for next year. Already, that will give you a clue. So it becomes very important to find out the circumstances that surrounded the onset of that particular symptom. At times, someone will tell you, okay, I have severe abdominal pains. My stomach is paining. Usually a patient will just say stomach, but you know it's the abdomen. You're not sure whether the pain is coming from the stomach yet. So you record it as, okay, abdominal pains. So you may want to find out, so how did this pain start? Did it just start on its own? Did it start after you ate something? Or were you hit in the stomach? How did it start? So the onset becomes very critical, not just when the symptom started, but how it started, the circumstances that surrounded the onset of this particular symptom. That's the onset, the O. Then you go to the L under ODCAT, that is location of the symptom. For instance, if your patient has come with abdominal pains, you want to find out where exactly on the abdomen is this pain, okay? Where is it? And you want to describe it based on what you learned in your anatomy, that the abdomen can be divided into 9 regions, or you can divide it into 4 regions. So you want to indicate the exact location of this particular symptom, because it will give you a clue as to what may be causing that particular problem. For instance, if this is pain that is in the epigastrium, then definitely you start thinking of what? Gastritis, okay? You start thinking of peptic ulcer disease. You start thinking of even gastroesophageal reflux if it is also associated, for instance, with chest pains. So location of the symptom. Where exactly? Are you able to point where the pain is? If it's a headache, ask the patient, okay, which part of the head is actually painful? They'll be able to tell you, because different types, different conditions will cause a headache um, in different locations. For instance, if your patient has a condition known as sinusitis, where there's inflammation of the paranasal sinuses, your patient will have like pain around the face, okay, and behind the eyes. So that is why it is important to ask about the location of the symptom, because for me, the moment the patient tells me, okay, the pain is around my face, I'll immediately I have a clue that, okay, that could be sinusitis, but maybe not, okay, but already you get a clue. There are certain locations that immediately tell you something. A patient comes with abdominal pains, okay? They point in the right lower quadrant. Immediately you start thinking, okay, that is the area where the appendix is. So the location of the symptom becomes very critical. The next part, you want to ask the duration of the symptom. So for how long have you had this pain? Okay, that is the duration. For how long have they had this particular symptom? Now, here also, you don't just want to ask for how long have you had this symptom. You want to ask, has this symptom been continuous? Has it been on and off? Okay. Has it been intermittent or it has been continuous? So it is not just a matter of asking for how long and the patient tells you 1 week. So, okay, have you had this pain continuously every day for the past 1 week? Or it comes and goes? Okay, so already you begin to get clues. Okay, if it is on and off, are there any things? Now we move on to the next. Okay, I'll relate this to the next symptoms. Next characteristics. Remember that all these characteristics of a symptom are actually related. So you are like a police officer using all these clues to try to get to the bottom of the case that you're investigating. You've asked about the onset, when, how this particular problem started, where the problem is, how long, okay, this problem has been, and then you move on to the characteristics of the symptom. Maybe let me just say something more about the duration of the symptom. Duration is very important because it will help you to even classify the nature of the symptom that you're dealing with. For instance, if a patient comes in with a cough, okay, and they tell you that they've been coughing for how long? Okay, I think 3 weeks now. Immediately you begin to think, okay, any cough more than 2 weeks, you start thinking of tuberculosis. So duration becomes very important. If it is diarrhea, for example, your patient has had diarrhea and you ask for how long has this complaint of diarrhea been, they tell you that they've had it for 14 days or maybe 15 days. Until you start thinking, okay, this is I'm probably dealing with persistent to or chronic diarrhea. What could be the cause? Most likely, am I dealing with maybe an allergy? The patients that are allergic to certain foods will usually present with chronic diarrhea because whenever they eat that food, they'll have the diarrhea. Okay, so when you ask about the duration, you even begin to get ideas of what could cause this particular kind of symptom. Characteristics of the symptom. So under characteristics, you want to find out the nature of the symptom. If it is the headache, you want to ask, what kind of pain are you experiencing? Is it a throbbing pain? Okay, is it a sharp pain? Is it a dull pain? Now, a simple rule of thumb, especially quite particular to the abdomen, for example, is that pain that is dull in nature and it is aching or burning in nature is usually visceral pain. It also applies to the chest. Pain that is arising from organs will usually be dull in nature, okay, or it may be burning or aching. Whereas pain that comes from the pleura, okay, or the peritoneum, it may be sharp, okay, particularly, especially with the pleura. If a patient is experiencing sharp chest pains associated, for example, with breathing, then you know, okay, most likely that pain is coming from the pleural, okay? Maybe the pleura are inflamed, okay? But if they tell you, okay, this is a dull kind of pain, it is numb in nature, or it is aching or burning, you start thinking of visceral pain. So it is important to find out the characteristics. If it is vomiting, for example, under characteristics, if your patient is presenting with vomiting, you want to ask, so this vomiting that you're experiencing, what is the color of the vomiters? Is there any blood in the vomiters? Okay. What is the nature? What is the force with which you're vomiting? Is it coming out with a lot of force? Okay, you want to find out if the vomiting is projectile or not. So those are the characteristics of the symptom. Then you move on, excuse me, you move on to the aggravating and alleviating factors. Under aggravating and alleviating factors, you want to find out aggravating, okay, to aggravate is to worsen, to alleviate is to relieve, okay, to make less. So you want to find out what makes this symptom worse and what makes this symptom less, worse, less. So ask about what worsens the symptom. If it is, for example, the headache that I had talked about, a patient who has, for instance, sinusitis, if they bend their head, okay, the pain worsens because they feel like there's a lot of pressure on the face, okay, as they bend over. So what worsens this headache that you're experiencing? The patient will tell you, okay, when I turn my head or I just face down, I just feel as though my whole face is, you know, it has a lot of pressure and it is painful. You know that, okay, probably that is sinusitis. If it is, for instance, chest pain, okay, you ask, so what do you think? Have you noticed anything that makes the chest pain worse? They'll tell you, okay, this pain, when I'm resting, I have no problem. But the moment I start doing some activities, okay, the moment I start doing some activities, maybe I am washing the car, that's when this pain starts. Immediately you will know that, okay, this is a kind of pain that is associated with um, engaging in some physical activity. So it is pain that is made worse on exertion when a patient is performing some activity. So you know, okay, this could be angina. That is the importance of asking about the aggravating factors. What about alleviating factors? What makes this symptom to reduce? Okay, what makes it less? For instance, if it is gastritis, your patient has gastritis, they'll tell you, okay, when I take some milk, I get a bit of relief for a short period. You start thinking, okay, are we dealing with gastritis here? Or perhaps peptic ulcer disease, okay? They'll tell you, okay, for me, this chest pain, when I just sleep, okay, I rest, the chest pain stops. Then you know, okay, that is really pointing towards angina, for example. So um, that is how you conduct your symptom analysis. Then you move on to the ARA, which is the related symptoms. You move on to the ARA. Remember, we're following this acronym here, ODCAT. So we've done the onset, location, duration, characteristics, and aggravating and alleviating factors. Then the ARA is the related symptoms. The ARA stands for related symptoms. So you want to find out, When the patient experiences this particular symptom, do they also experience something else? And the reason why you're asking this is that you want to find out there are certain symptoms that when they occur in relation with another symptom, they'll give you a clue as to what the problem might be with the patient. So for example, if a patient comes with if a patient comes in with for instance, the chest pain that we were talking about, okay? They come in with chest pain, and you have discovered that this particular chest pain is made worse with exertion. When a patient does some physical activity, the pain worsens. Okay, so what you want to do is that you want to find out, okay, what are the related symptoms? When you experience this particular pain, what else do you experience? Okay. Sometimes the patient may not be able to identify, but you'll have to give them clues. You have to ask whether they experience certain things in relation to that symptom. So when you experience this chest pain, do you also have any difficulties in breathing? If they tell you yes, then then that difficulty in breathing becomes a related symptom, because your patient experiences chest pain and they also experience difficulties in breathing. Do you also experience swelling of limbs? Okay, your lower limbs, do they swell? They'll tell you yes. And okay, edema of lower limbs becomes a related symptom. Okay, then you go to the T. T is treatment, self or prescribed. So you ask them, have you taken any treatment for this particular symptom? They'll tell you yes. Ask, what type of treatment was it? Was it prescribed, or did you just take it on your own? Was it conventional treatment, or was it traditional treatment? You want to find out all that, including what effect it had on the patient. So did it work? For instance, if your patient tells you they came in, they were experiencing abdominal pains, and they chewed some magnesium trisilicates, they chewed some magnesium, and you want to ask them, so what happened after you took the magnesium? They will tell you, okay, the pain reduced a little bit. Then you start thinking, okay, if magnesium trisilicate could work for this patient's abdominal pains, maybe I am really dealing with a situation that where this patient has a lot of acid. So the condition the patient is experiencing is acid related somehow. It gives you a clue. Okay. Okay, so that is on treatments. Then the last part in the odd cuts in symptom analysis is the severity of the symptom. How severe is the symptom? So you want to ask the patient, how serious is this problem? This is where, when you're conducting an assessment, you use various tools. For example, if you are assessing pain, you want to ask this patient, so how severe is this pain? On a rate of 0, maybe 0 to 10, or 1 to 10, on a scale of 1 to 10, let's take it that 1 is no pain at all, okay? But 10 is the worst pain that one can ever experience. Where would you place your pain? They'll tell you, this pain, I think 6, okay? So you know that your patient's pain is moderate to severe, okay? So you can ask the patient to rate the severity of the symptom. Okay, so that is the history of present illness. History of present illness is basically an analysis of that particular complaint, to ask when it started and how it started, to ask the location, the duration, the characteristics, aggravating and alleviating factors, related symptoms, treatments taken, and the severity of the symptom. Now, when you are conducting a focused health history, this becomes the main part of the history taking. Okay, If you're collecting a focused health history, this part where you conduct the symptom analysis becomes the main component of your history, because even in emergencies, this information at least will be adequate to give you a clue as to what may be wrong with the patient. Please remember the acronym ODCATS. Okay, so in the next video, we're going to look at past health history. But for this video, we'll end here. Okay. Thank you very much.